And now we've got a message from our sponsor, the CareQuest Institute for Oral Health. Please welcome Dr. Maisha Minter-Jordan, President and CEO of the CareQuest Institute for Oral Health, in conversation with Dr. Eleanor Fleming, Associate Professor at Meharry Medical College. Maisha, over to you.
Good afternoon. My name is Dr. Maisha Minter-Jordan, and I am the proud President and CEO of the CareQuest Institute for Oral Health. I'm excited to be with you this afternoon to discuss an important topic that matters to us all. The CareQuest Institute is focused on ensuring equitable access to integrated healthcare for underserved populations. One of the things that we are clear on is that oral health is healthcare. And we are so excited to have so many leaders amongst us today who believe the same. I am thrilled to be joined today by Dr. Eleanor Fleming, a diplomat of the American Board of Dental Public Health. Dr. Fleming is a veteran of the Public Health Service and has served as a dental officer epidemiologist with the Centers for Disease Control and Prevention. We're going to spend the next few minutes talking about the inequities that exist in oral health care, the opportunity that we have in front of us, and how we can finally solve these long-standing challenges. Welcome, Dr. Fleming.
Thank you.
So, Dr. Fleming, your path to dentistry is a unique one. Can you tell us about it, please?
Absolutely. You know, I found my way to dentistry through Dr. David Satcher and the first Surgeon General's report on oral health. At the time, I was in graduate school, and when I heard him speak about oral health disparities, that information left me dumbfounded. I did not understand then and don't understand now how it is possible that people do not have access to dental care. I grew up going to the dentist and the orthodontist, saw dental offices everywhere in my hometown. So the idea that people do not have access to care makes no sense to me.
I think you and I share that same sentiment. As a practicing physician and in my former role at a community health center, one of the things that I was struck by was the children in our Head Start and Early Head Start program, in the amount of oral health disease that they had. And I learned that in order to correct that oral health disease, we were putting little children under anesthesia. And the thought that that was preventable was dumbfounding to me. And it made me really look towards how we could have a more integrated system within our community health center. And that thought has carried me through to the work that we do today at the CareQuest Institute for Oral Health.
You know, that is a great point, and I think that we have that shared experience. I mean, at my local Boys and Girls Club when I was in high school, I didn't understand why these children had so many silver teeth. And I didn't understand, like, why do these kids have this? And, you know, come to find out, you know, the children had decay, and to save their primary teeth so that their permanent teeth could erupt, you know, their pediatric dentist had to save those teeth and protect them with stainless steel crowns. And so here we are with little ones with shiny teeth, and, you know, one wants to be excited and not make the child feel, you know, different. But one must wonder, why is it that, at least for me as a Black woman, why is it that Black children have that disparity in care and have that experience with disease when we know what works to prevent dental decay?
You are so right in that. So at CareQuest Institute, one of our greatest missions is ending the deep disparities and inequities that exist in oral health care for our most marginalized populations. The first report that you referenced was published in 2000. Can you tell us about some of the inequities that exist today?
As a dental epidemiologist, I approach problems of inequity from a systems level. Our systems are failing millions of people, and Medicare is a great example. Medicare's lack of an oral health benefit means that nearly half of all enrollees, more than 24 million Americans, do not have dental coverage. These are disproportionately Black, American Indian, and Hispanic people, those with disabilities, and those living in rural communities who are left without a way to afford the care that they need to maintain not only their health, but also their well-being. The statistics are astounding. And the last year, 7 out of 10 Black Medicare enrollees and 6 out of 10 Hispanic enrollees did not see a dentist. And 20% of rural seniors have not seen a dentist in more than 5 years. And we know as clinicians that, we encourage our patients to visit a dentist at least twice a year.
So I think for many of us, those statistics are not really surprising. I think we know that they've long existed in particularly marginalized and underserved populations. Understanding the data is critically important, but let's talk a little bit about what those statistics actually mean. What is the result of someone not being able to access integrated and comprehensive oral health care?
This is a critical problem because research shows that oral health is inextricably linked to overall health. Poor oral health can lead directly to a higher risk of chronic diseases like diabetes and heart disease. It can also contribute to depression, poor maternal health outcomes, and sometimes death. Research from CareQuest Institute and others have shown that poor oral health increases risk associated with COVID-19. Despite this, many state Medicaid plans, do not cover basic dental care for adults. It makes absolutely no sense from a medical or policy perspective.
I think you are exactly right in the sense that failing to cover dental benefits under Medicare makes no sense from a medical policy or ethical perspective. If the pandemic has shown us anything, we know how inequitable our healthcare system is and how vulnerable our seniors are. Including dental coverage under Medicare will help address both of those challenges. Can you talk through some of the reasons why covering dental care under Medicare makes sense from your perspective?
You just laid out a number of important reasons, and personally, I find this to be an equity and social justice issue first and foremost. But let me also add, it makes financial sense. Studies have shown that adding the dental benefit would result in a reduction in long-term healthcare costs. Providing benefits to people with chronic diseases has been shown to result in reduced healthcare spending. Additionally, people without dental benefits also find themselves seeking care at emergency departments, which are not equipped to provide the type of care and also add significant cost to our healthcare system. One estimate of the cost of avoidable emergency room visits nationwide for dental reasons is $1.7 billion annually.
So we've laid out an incredible case for the inclusion of an oral health benefit in Medicare. We've talked about the data, we've talked about the moral case, we've talked about the inequities that could potentially be solved by this inclusion of a benefit under the Medicare policy. As you think about what happens with Congress, and if this is truly passed, what do you see as next steps?
Well, strengthening Medicare would be a great start, but there is a lot more that we need to do to create a healthcare system that works for everyone. It's important to note that a dozen state Medicaid programs, including my own state, do not cover routine dental care, which again has a disproportionate impact on low-income people and people of color, and that needs to change. As you mentioned, we also need to take a look at how we deliver and pay for care. We should move from a system that compensates providers not based on the number of procedures they complete, but on the quality of care that they deliver. Transitioning to value-based care is a way to do that. Now, the advantages of value-based care are clear: greater innovation, lower costs, and more importantly, better health outcomes for patients and populations. Getting to that reality, however, will take innovation, persistence, and a redesigned oral health care system. I realize that this is a lot that needs to be done, but I know that we can get there. And the step that Congress is considering now, with dental benefits added to Medicare, is a critical step in that direction.
Dr. Fleming, thank you so much for an engaging and informative conversation. Your perspective and your expertise has been enlightening for so many of us here today. We are on the brink of an important moment in our nation's health history. This is the time for us to stand up as leaders, to become engaged in this fight, and to ensure that Medicare finally addresses the oral health of seniors, millions of seniors across our country. I am emboldened, engaged, excited, and committed to ensuring that this happens for seniors. Because we know that if this happens, the inclusion of oral health in Medicare will finally begin to address some of the systemic inequities that have plagued our country since its inception. We'll finally begin to address some of the disparities that our seniors face. and the inequities, particularly that people of color face as it pertains to accessing oral health. This will set a moment in time for us to learn from, to us to move with, and I'm excited to be able to do so. Thank you so much for joining us, and thank you so much for being committed to ensuring that oral health access is equitable for all. Thank you.
Maisha and Eleanor, thank you very much for that discussion. I learned a lot. Appreciate it.